So, one of the most common phrases I hear in clinical practice is patients telling me, my doctor told me my blood work is normal, but I still feel like something isn't right. I'm experiencing fatigue, weight changes, low mood, digestive issues, poor sleep, but everything still comes back normal. Well, my name is Dr. Khalil and I'm a licensed naturopathic doctor. And today I want to explain something very important. Normal blood work does not always mean optimal blood work. And once you understand this, you will never look at lab results the same again. So first, I want to be very clear. Lab testing in conventional medicine is incredibly valuable. If someone is dealing with kidney failure, diabetes, acute infection, or serious disease progression, or whether you've even had a heart attack, lab markers are essential. They do save lives, but they are designed to detect pathology, monitor disease progression, and prevent medical emergencies. But those numbers are not there to optimize your health. In most cases, what we call normal lab work is actually a statistical reference range based on a population average. Now, it is not based on how well the human body functions at its best. So in reality, normal blood work often means you're not sick enough to fall outside the range, but not necessarily that you are thriving either. So to start, I want you to sit with this idea. In every area of your life, we do not accept average as the goal. We do not aim for average grades. We don't aim for average performance reviews at work. Yet when it comes to our health and our bodies, we are often told that normal is enough. But your body isn't designed to function suboptimally. It is your vessel for life. You have to take care of it and you have to understand it. So let's talk about the most common problematic labs I see in clinical practice. So iron is the most common issue I see in my practice, especially for young menstruating women. Most women are told their hemoglobin is normal, so everything is fine. But hemoglobin is a late marker. Before that drops, we assess a marker known as ferritin, and ferritin reflects iron storage. And I often see women with ferritin levels at like 14 or 18, technically within the normal range, but they're exhausted, they're losing their hair, they're struggling with exercise tolerance, or they're having thyroid irregularities. And in optimizing your health, ferritin should look closer to 70 or 80. Do you see the gap between those two numbers, 14, 15? To 70 to 80, depending on that person. We're not talking about disease, we're talking about optimizing function. So if you have any of those symptoms related to low iron, you have to optimize your ferritin levels. The other lab marker that I like to look at and I find is extremely crucial is vitamin D. A lab might show, for example, 77, but the cutoff is 75. So you're just hovering above normal, right? But in functional and integrative medicine, we often look closer to 100 to 110. Do you see that discrepancy of about 30 points when it comes to optimizing vitamin D levels? And if you live in colder climates, vitamin D is not just for bones. It's a hormone precursor involved in immune regulation, inflammation control, and even cancer prevention. So most people who live in very cold winters and long months of darkness, they do require higher levels of vitamin D or vitamin D supplementation. Now, the question is the blood work optimal based on your unique needs, or are you sitting at a suboptimal range? Now let's talk about thyroid health, and this is a big one. Many people are told that their thyroid is normal. Meanwhile, they've only one marker known as TSH, which is your thyroid stimulating hormone. It's a pituitary signal, so not a full picture of thyroid function. To truly assess thyroid health, you need to run the full panel. So T3, T4, free T4, reverse T3, thyroid antibodies, and also thyroglobulin. So there's so many aspects in relation to thyroid health that needs to be assessed, especially if you have symptoms that are related to, for example, a hypothyroid picture where you have weight gain, constipation, thinning hair, fatigue, and TSH can still look normal when some markers are off. The good news is that a lot of integrative medical doctors or functional medicine practitioners who come from the conventional framework of lab work are understanding that their patients require a full and thorough thyroid assessment. So although there are a lot of markers in blood work that I like to look at, one of the big ones that I see in clinical practice and I really want to hone in on today is blood sugar. So you might be told your blood work is completely normal in terms of blood sugar because your fasting glucose falls within the lab reference range. But by the time your fasting glucose starts to rise, insulin resistance has often been developing silently for years. And I see this in women, that are even in their early 30s where those shifts begin to happen. The same is true for HbA1c. HbA1c is a 3-month blood sugar average. And many people are reassured that an HbA1c that's even hovering close to prediabetes is fine. But that's actually a sign that blood sugar regulation has already become impaired. It's not the beginning of the problem. It's evidence that the process has been unfolding for some time and requires intervention. I created a video on insulin resistance, but I wanted to kind of bring that into this video as well because insulin resistance can easily be caught in blood work. It develops gradually long before someone is diagnosed with even type 2 diabetes. The body often produces more and more insulin to keep the blood sugar looking normal. Now, during this stage, people may notice symptoms like fatigue after meals or increased abdominal fat, sugar cravings, difficulty losing weight, brain fog, elevated cholesterol, changes in blood pressure, hormonal imbalance, the list goes on, even though they're told their labs are fine. This is why I don't ask whether your numbers fall inside the laboratory range of normal. I ask whether they're moving in the wrong direction and what they're telling us about your metabolic health before disease develops. The goal isn't simply to wait until diabetes appears or hypothyroidism appears or, severe low vitamin D status. It's to recognize the early warning signs and intervene while the body is still highly responsive to lifestyle changes. So this is where integrative and naturopathic medicine comes in. We're not replacing conventional medicine. We are filling in the gap between disease and optimal function because most people do not fall into neat diagnostic boxes. They fall into the space between normal and not well. And I want to be very careful here. This is not about becoming obsessive about your health or chasing perfect labs. It's about awareness, because what I see in clinical practice is patients coming in exhausted, with ferritin sitting at 14, vitamin D sitting at 77, thyroid symptoms present, blood sugar instability, and being told everything is fine because nothing is outside the reference range. But they do not feel fine, and that disconnect matters. Your body is always communicating with you. Symptoms are signals that your body is giving you. And when those signals are ignored because labs are normal, we miss the opportunities for prevention. And that's what medicine should be, not just disease management and disease progression prevention. Basically, what I'm trying to tell you here is that everyone's talking about longevity medicine, but it's really preventative medicine, not waiting for disease, but understanding dysfunction early and supporting the system before it breaks down further. So some people don't understand that, they don't need the latest biohack. They don't need the latest peptide. They don't need a whole list and array of supplements. They need to run their labs. But they also need to run their labs in a way where they understand them properly, not just as a pass or a fail, but as contacts, as signals, and as part of a much bigger picture of your health. So if there's one thing that I want you to take away from this video is this: normal blood work does not always mean you are healthy. It simply means you are not currently outside the disease threshold. And there is a very wide space between those things. So remember, your body isn't working against you. It's giving you signals and it's communicating with you. So if you feel like your labs are being run and you're being told that your labs are normal, but you don't feel like yourself, then you have to dig deeper. You have to seek further answers. You have to get integrative care. The more you understand it, the more empowered you become to make informed decisions about your health. So if you found this video helpful, give it a thumbs up, subscribe, and share it with someone who needs to hear this. And if there are topics that you'd like me to cover next, leave them in the comments below. So thanks for watching, and I'll see you in the next video.